My name is Emily Hall. I'm the Vice President of Sales and Marketing for InterDev Technologies. And there are a few new names and faces on the call. So just quickly, InterDev is a solutions provider to emergency services. And we work closely with many of the partners on the phone, including educators and EMS and some fire. And we're so pleased to have you all on the call. We've been doing this webinar series and we've been focusing on sort of information that's peripheral to or relevant to our product line. And so we thought today for our final webinar of the series, and we'll take a break for the summer, give you guys all a bit of a rest and probably re-up the series at the end of the summer, we would do something that was a little off the cuff. And so I reached out to my friend Rob Theriault, who has generously agreed to keynote this presentation and give us some information about what he's been doing. So obviously you guys have seen the information about the webinar, so I won't spend too much time, but rather I'll probably send it over to Rob to introduce himself, and I'll go ahead, Rob, and make you the presenter so that you can take over the screen.
Okay, sure. Hi, everybody. Great to see some old faces, people I've known for 30 years or more, which is really exciting. A little bit about me. I've been in EMS since 1984, and I retired from the road a year ago, and I am a full-time educator. So I've been in the field for 35 years. I was a critical care flight paramedic for a few years, and then worked as an advanced care paramedic in the Halton region for about 16 years. And through that time, I've been teaching really since the start of my career, but teaching full-time for about the last 20 years. And last year and a half ago, we integrated virtual reality into our paramedic lab for patient simulation, teaching empathy, and started exploring online learning in a virtual reality space. And that led to a conversation with our president and vice president academic, and they created a position, a 2-year secondment, and I applied for it and got it. So for the next 2 years, I'm the immersive technology lead for the college, and my role is to help faculty and programs to integrate virtual or augmented reality into their curricula where appropriate and desirable. So it's a big change of pace, and I'm pretty excited about it. So I spend my days exploring virtual reality and talking with companies around the world about VR and about their products, and really grateful to be able to connect with those companies so they get a better understanding of what we need as educators from a virtual reality perspective. So let me see if I can navigate through my slides here. So let me just, by way of sort of how I got to this place, I did a master's in educational technology, and I was exploring virtual and augmented reality at that time. But I really started to buy into it when I attended a conference in Washington, D.C. By the National Association of EMS Educators. And I walked by a booth where someone was in virtual reality, and he had a headset on, and I could see what he was seeing on a big TV screen. And honestly, looking at the TV screen, looking at the scenario that he was doing, it really wasn't impressive at all. It just looked like a run-of-the-mill scenario that you would see on computer. But then I put the headset on, and the experience was completely different. I was in the room of this apartment with a patient who was struggling to breathe, and I could hear him struggling to breathe, and I could see the anxiety in his face, and I could see his use of accessory muscles. I could see he was a little bit cyanosed, and I pulled out a digital stethoscope and I auscultated his chest, and I could hear adventitious lung sounds, and I could take vital signs and put on a monitor, and I could ask him questions. And when he answered questions, he was only able to speak 4 or 5 words between taking breaths. And so I was able to assess him. I was able to treat him. I was able to load him into the ambulance and initiate transport. And at the end of the experience, it was a little like if you've ever been to a really thought-provoking movie where at the end of the theater you just didn't want to talk to anyone, you were so immersed in your own thoughts, you were trying to process what you'd seen and experienced, that was the kind of feeling I got when I experienced virtual reality for the first time. And two things struck me. One was that this might be really beneficial for my paramedic students, because especially in first semester, second semester, we talk about cases, we describe patients who are sick and injured, but they really have no context. So number one, this gives them context. Number two, it gives them a form of hands-on learning. It's really, virtual reality is experiential learning. I won't talk about augmented reality too much. My focus is going to be mostly on virtual reality, but it's really about an experience. And so this is unlike any other educational technology that's come before it. And that's one of the things that's really compelling. So I'll talk a little bit about some case use at the college where I teach, if I'm able to navigate through the slides. So when I say virtual reality, I mean specifically immersive virtual reality, because virtual reality can mean, this webinar we're having right now is virtual reality. Virtual reality can be on a PC, but when I say immersive virtual reality, what I'm referring to is donning a headset and being immersed in a 3D world, like being inside a video, and the outside world is you're completely separated from the outside world. So number one, it's experiential, which is really intriguing and compelling. Number two, it's spatial. So you can move around in this 3D space, and the quality of the headsets and the rendering of the video has reached a point where there's lag that's imperceivable to the human eye for the most part, and so you feel like it's real. You feel like you're really there, and that's quite interesting. And when you're I do some online teaching in virtual reality, and your students can be attending a lecture, and then they can go off in a distance and do group work, and nobody hears their conversation because we're far away. So just like in real life, if they go into a separate room and have a conversation, they're having a private conversation, unlike a webinar like we're on right now, where if mics weren't muted, people would be talking. And so a webinar, which is probably the main tool of educators at the college and university level right now because of the pandemic, is probably the weakest form of educating. Right? I mean, I say to people, the quickest way to anesthetize your audience is give a lecture and put everyone on mute. People just start to fall asleep. But if you're actually with people, that's a whole different experience, even if it's in avatar form. That's quite different. So I won't say virtual reality is going to replace other forms of learning. Certainly not going to replace hands-on learning, but it supplements the learning, and this can be very powerful. But there are a number of pedagogical considerations, not just considerations for pedagogy's sake, but also because virtual reality hardware and software can be fairly expensive, and so these are things that are important to take into consideration. But for example, when you think about pedagogy, I think about what domain does the virtual reality experience address? Does it address psychomotor, cognitive, or affective domain? And I'm not going to talk about the affective domain, but virtual reality is very powerful for altering perception. And it's being used, there are a number of virtual reality experiences where you can be embodied in someone who is on the autism spectrum, or a person of color who experiences cultural aggressions, someone who's a woman and experiences sexism in the workplace, and actually sort of possessing the avatar of someone else is literally like walking a mile in someone else's shoes. It's a very profound experience, much more profound than having discussion around those sorts of things. So that's the affective domain. And we have to think about, I think about VR in terms of Bloom's taxonomy. Does it address sort of the lower end knowledge and comprehension, or is it the higher order thinking? And I can just tell you from my own experience communicating with companies that develop virtual reality that most of the applications are target the higher order thinking levels. So they're mostly aimed at third year paramedic students, third and fourth year nursing students, physicians, residents, et cetera, which is good. I'm hoping more companies develop applications to address the needs of first and second semester students, but we'll see how that goes. So software and hardware, I won't talk too much about that other than to about the hardware to say that virtual reality is sort of divided into headsets that are standalone that don't require connection to a phone or a computer or anything. And that's where education is going, is this standalone headsets, and then headsets that require connection to a high-end computer. And that might be perfect for paramedic services in base hospitals where you've got a location, a physical space with a computer and a headset. You'll get higher quality graphics with that, and you get access to a greater number of VR applications with PC VR, we call. But for me, as a college educator, I'm more interested in standalone because I'm interested in distance learning, and it's a lot more practical to send a headset out to a student's house instead of a headset and computer. Space can be an issue because you've got to, if you're doing things in virtual reality, you need a space. And pricing is another consideration as well. Jeremy Bailenson, if you're interested in reading some of the research on virtual reality, Jeremy Bailenson is the director of the Virtual Human Interaction Lab at Stanford University, and he and his colleagues have done a lot of research, especially around the psychology of virtual reality and the impact of embodied cognition when you're in avatar form. And in his recent book, he suggests that if you're going to adopt virtual reality, think about, for the best return on your investment, think about whether virtual reality addresses something that's dangerous or whether it's impossible or impractical. So, as an example, it would normally be impossible to bring a jet engine into a classroom and fire it up. It'd probably kill everybody in the room, but in virtual reality, you can do that. Whether it's counterproductive or whether it's expensive. So, we're looking at virtual reality right now for our power engineering program where they have to learn about these big boiler plants and everything. It's very expensive to get students that kind of experience. So my role is to help programs across the entire college, all campuses, to explore virtual reality. And I'll just give you some examples. So we're looking at doing some pilots this fall with our biotech degree, our Indigenous studies, our veterinary technician program, and then doing some new stuff with our paramedic program. And so biotech, for example, they're using a program called Nanome, where the teacher and the students can go into a virtual space and they can look and manipulate molecules. They can pull them apart, they can add atoms, pull out atoms, change the structure. And Nanome is actually a product used by science researchers around the world to explore novel viruses, to explore CRISPR technologies and genome editing, and also develop new drugs. So it's a very well-known product. Indigenous Studies is looking at teaching languages in virtual reality. So they have a course called Language in the Home. And so we're building a virtual house for them. And so they're going to be bringing their students into this house and spending time in the kitchen and different rooms of the house and in the backyard and the deck and going over language for that stuff. It's very cool. And our vet tech is going to be doing animal dissection in virtual reality and also having classes in virtual reality. And as I said, we're exploring VR in a whole bunch of different areas. So just to brag a little bit, our students did a applied research project last year comparing virtual patient simulation to in-lab patient simulation. It was really sort of a proof of concept. It was a small cohort, so we didn't look at publishing it. What they did essentially was compare virtual reality to analog simulation to see if students assessed, treated, and made decisions in more or less the same sequence in VR versus lab, with the idea that from that, we can infer that students, that the VR would be a good learning experience to supplement their lab experience. And they found about an 80% similarity level. And our students actually presented at the first and largest virtual reality conference in the world. There were 170 speakers and 6,000 attendees on a platform called AltSpace VR, which is a Microsoft product. And so I was there. Ian Drennan and John Lee, who most of you probably know, were also involved in the research. Ian Drennan was teaching the course, and John Lee was helping out, and I was helping them out as well, of course. So when I think about virtual reality from a pre-hospital care perspective, from first responder care perspective, I think about immersive virtual reality for simulation, for learning skills, or developing critical decision making. And so you can divide, or at least I divide, virtual reality experiences into ones that have local agency, meaning you can do things with your hands, and you're developing muscle memory or body cognition, versus full out scenarios where you have global agency. Global agency is the term in VR that means that you're doing things, and as a result, there's a change in outcome, either good because you gave the right drug at the right time or the right dose, or bad because you gave the wrong drug or you neglected to give a drug, etc. So local versus global agency. And sorry, I was going to say, we know that from the research anyway, that active knowledge improves knowledge acquisition. So here's an example of a virtual reality program that has local agency, and in this case, appropriately so. This is an anatomy program by a company called Organon out of Australia. And just by way of some of the evidence, there was a study done using a different anatomy program, but that showed that students had about a 9% increase in knowledge retention in an immersive environment as opposed to anatomy on a traditional computer screen. So let me just play a brief clip of this video so you can see what it looks like.
Hey, Rob.
Yeah.
Unfortunately, we can't hear this.
Okay, well, that's all right, because there's not much
Okay.
except music. So
Oh, good. Okay, good.
you're actually not missing anything.
Okay.
So and the other ones I can just, maybe I'll just narrate what we're seeing.
Perfect.
Yeah, okay, that's good to know. Little glitch there. Yeah, so let me just play it again. So since you can't hear the music, so essentially you're in this room with a life-size skeleton, and you can point and click at body parts, bone, nervous system, etc., and it'll identify it, or you can pick it apart and reassemble it. There's a quiz function. But the coolest thing is you're in the room. So you can walk around this body, you can walk to the corner of the lab, you can have a teacher and classmates in there for anatomy lab. And one of our nursing faculty is looking to do a pilot teaching anatomy in virtual reality, so that should be fun. Just move to the next slide. So these are a couple of applications that have really good local agency, and local agency is important. I mean, you know, if you're a paramedic educator with a service or a base hospital or some other first responder service, you're probably thinking that you want applications that teach higher order thinking, because you've already got seasoned healthcare professionals that you're responsible for, and that's fine. As an educator from entry level, agency is really important, and this would be important for you for new skills acquisition. But UBSIM is a program that I quite like. It has a great deal of agency, and so, for example, if you were going to administer insulin, you would, in the VR experience, you would come into the room, you would identify the patient, you make sure it's the right patient, you would go over to the sink and wash your hands, and it would time you to wash your hands for 20 seconds, and then you go to the stock room and gather up all the equipment you need, and then you bring it back out, you would assemble it, and then you would administer it. This one on the right is by a company called Also VR, and their primary audience is surgical residents and surgeons. And so they have a lot of local agency type applications where they teach skills. And there's an interesting study using that application that was published recently. And let me see if I can move so I can see that. So I don't know if you're seeing the whole slide. I'm only seeing a portion of the slide, but essentially they took second-year medical students and had divided them into one group that did sort of standard training, which is essentially theory and video, and the other learned in virtual reality. And they found the percentage of steps done correctly in the VR versus standard was 63% versus 25%. And the retention level in VR group was 50% versus 11% in the other groups. So it's really powerful sort of proof of concept from a skills acquisition or a psychomotor perspective. Let's see if I can get this to move ahead here. Oh, there we go. This is a company called Arch Virtual, and fortunately in my role, I've had the good fortune to speak with people from all of these companies and have a pretty good rapport with them. Arch Vertical is doing a lot of VR development. Let me just play the video. It'll be self-explanatory. You probably won't hear it, but I'll narrate it a little bit. So basically you have a whole series of digital assets that you can manipulate, which is really amazing. So you can create your own scenarios. You can have an instructor in there with healthcare providers or students. You basically author your own experiences. This is someone doing some suturing. I'm not sure how that works in virtual reality, but it's certainly not intended to replace the hands-on experience, but really to help people prepare to learn the steps and to practice the steps over and over again so they get the most value from the hands-on experience. So we just pause that. Now you're probably looking at this and thinking, you're not getting any tactile feedback, so where's the benefit to this? And the benefit is largely in learning the procedures, rehearsing, practicing the procedures over and over again. There are some haptics. Haptics is the term that describes the touch experience that you get in a virtual environment. And so you can get haptic feedback for certain things. So for example, you can feel a carotid or a radial pulse, and your controller, which looks like a hand in virtual reality, pulsates or vibrates. And so it's not exactly like a pulse, but you still feel like you're measuring a pulse. And haptic technology is improving every day, and haptic gloves are getting increasingly more sensitive. Unfortunately, most haptic gloves are tethered to a computer, so we've got wires dangling off, which makes it a little cumbersome. But there's a pair of haptic gloves, for example, right now that's it's not consumer grade ready yet. It's in the developer stage, but where you can actually feel raindrops on the palms of your hands. So it's going to continue getting better. And as you might imagine, I'm hesitant to say this, but the porn industry is driving a lot of haptic technology to its full potential, if you will. And we'll just leave it at that. This is an interesting virtual reality experience. This is a group out of Texas who have a large ambulance bus, similar to the one in Toronto, for example. And they have a whole bunch of staff who work on this bus and have to staff it in the event of an emergency. And they do annual training, but they found that that was really inadequate and difficult because they service suburban and rural community, and so they have EMS providers who come from long distances. So what they did was they replicated the bus in virtual reality and had people refamiliarize themselves with the bus through virtual reality, and they found that the VR group had a, I have to move this stuff around a little bit, had a 29% reduction in time on task and a 46% reduction in number of errors when compared to the traditional group, which is really pretty amazing when you think about it. There's triage in virtual reality would be really great. There are only two companies that I'm aware of that have triage in virtual reality. One is commercially available from a company called, on the right there, called Real Response. They're based out of Australia. They're a company formed by two paramedics, and we have their triage application in our paramedic lab, and it's pretty good. The other one is one that was created by Edith Cowan University in Australia, and it's not commercially available, and we're looking at partnering with them to do a study on it, their triage platform, possibly this year, but we haven't had any discussions since the pandemic happened. But hopefully it'll be commercially available sometime in the future. What's exciting about this is that, as you know, running a mock disaster is a huge endeavor. It involves months of preparation and getting volunteers and moulage and actors and so on and so forth. And at the basic level, at the first responder level, paramedics don't get to practice triaging a whole lot. But in virtual reality, you could conceivably have 3, 4, 5 different scenarios, you know, an active shooter scenario, a terrorist attack with a bus scenario, a whole bunch of different scenarios that they could practice and really prepare for the real thing. And you could, you know, that would be a supplement, obviously, to the mock disaster that a service might run. But this would be a really cost-effective way of giving frontline providers training. And, you know, you could extend that to, you know, the overall management of a disaster scene as well in virtual reality. And Edith Cowan did do one study a year ago, and they found that that VR simulation provided identical efficacy for paramedic students compared to a live simulation. So really good proof of concept there. These are a couple of companies that have scenarios with global agency. VR Patients is on the left there, and their product is still in development. And just for conflict of interest, I'm, well, I don't work for the company, but I'm evaluating their product right now and giving them feedback. So I've signed a non-disclosure agreement with them. But I can say positive things about VR Patients. The cool thing about them is they're the only company in the world that I'm aware of that creates exclusively EMS scenarios, and they create nursing scenarios as well, but their focus is EMS scenarios. Most other companies develop physician and nursing scenarios because that's where there are many more physicians and nurses than there are EMS providers. So VR Patients is one of those products. And the other one is SimXR on the right here. And I'll just play this video clip. So first of all, I should tell you that not every virtual reality experience is multiplayer. Some of them are single player. VR Patients is a single player. May change over time, but SimXR is a multiplayer. So you can get multiple physicians, nurses, wearing headsets and managing patients in virtual reality. Let me just play this video. Again, I don't think we'll get any sounds, we'll just narrate it. See. So there was an explosion. Emily, I'm assuming you're not hearing the sound on this one?
That's right.
Okay. So you're saying there's an old IED. Washington's a guy on the ground and he's injured. So that odd looking head, bobbing head and hands, that's someone in virtual reality. And you can see they're two nurses in the other half of the screen who are doing the scenario. Now, I told the company I don't like these spots on the chest for auscultating because people don't come with spots, and they said you can remove them, which is good. So he's feeling for a pulse, and you can feel your controller vibrate when you palpate a pulse. So this guy's got a pneumothorax, so he's got diminished air entry on the right side. And you can't hear him speak, but he's struggling to breathe, and he can't speak in full sentences, which adds to some of the realism of the experience. So he's having another listen to the chest. And I'll pause it there. So anyway, he goes on to do a needle thoracostomy. What's cool is a couple of years ago, I bought my first virtual reality headset and computer, and Tyler Andre, who's an emergency room physician from Los Angeles, is one of the co-founders of this company. And he and I met in virtual reality, and we ran through 4 scenarios together. One of them was a scenario with soldiers who were up in a mountain on this mission, and one of the soldiers developed something called high altitude pulmonary edema. And diagnosing his condition was easy enough. The difficult part was that me, as a low-ranking medic, had to assert to the commanding officer that this soldier could not continue the mission, and that meant aborting the mission. And that was the difficult part, was the conflict resolution. And Dr. Andre said that I handled it well, given that I have no military background. I don't think he fully understands what a paramedic background is like, and that we don't take a crap from anyone. So that was a lot of fun. This is one by a company called Health Scholars, and I'm looking for funding right now to incorporate this into our advanced care paramedic program in the fall, because they just migrated from PCVR to the Oculus Quest, which is a standalone headset. So I'm excited about this. So this is ACLS, and they have an application for pre-hospital ACS and one for in-hospital ACLS, and it's too bad you won't be able to hear the voices, because that's critical. So I'll tell you what you're seeing and hearing as we go along. But it uses voice recognition and artificial intelligence. So essentially, you're in a room full of paramedics or pre-hospital care providers, or you're in a hospital if you've got the hospital version, and everyone in the room has a name tag, and you basically just bark out orders, tell people what to do. Aaron, can you check for a pulse? Charles, can you start chest compressions? Fatima, can you start an intravenous line? Becky, can you give a milligram of epinephrine? And so you run through these, STEMI calls, other chest pain calls, various different cardiac arrests. And the program, like a lot of other virtual reality programs, use analytics. And so it gives you an analysis of your performance at the end, tells you what you missed, what you did too soon or too late. And it's very cool. And there's a guy by the name of Tim Cobalt. He's an emergency physician from Columbia, Missouri, and he's training his residents right now. Well, he's doing a randomized control trial where he's randomizing his residents to medium to high fidelity simulation versus simulation supplemented by virtual reality. So I'm hoping he's going to publish that study soon. Very cool guy. I can introduce you to him if you like. And the other cool thing he's doing, just as a sidebar, is of course, because he looks after the education of all the emergency residents, and residents are under a tremendous amount of stress, he's doing another study on stress reduction for residents, where he's using virtual reality. So the residents come in after 8 hours, 10 hours, they fill out a stress assessment form. They experience about 5 minutes of virtual reality meditation, and then they fill out the form again to see if there's a change. And so I'm interested in that publication when it comes out as well. He's got this little room set up with lawn chairs and like a electric sun and some fancy empty glasses that look like alcohol drink glasses, and they just sit down and put the headset on, and go into this beautiful space and experience some meditation. So anyway, this is the ACLS scenario. Let me play it.
Rob, is it possible that oh no, your sound is on, right?
My sound is on, yeah.
Yeah.
I'm not sure how to
Yeah,
correct
I've had
that.
this trouble. It's too bad. Okay, sorry.
Yeah, no worries. I'll narrate. Okay, so you've got a team leader with the headset on, and you're looking at a virtual team. And as I said, they all have name tags on. Here he's asking Aaron to turn on the lights. So you've got a cardiac monitor, you're able to see and interpret the rhythm. You've got a pulse oximeter, not for dead people, we don't use pulse oximeters, but you've got end-tidal CO2 as well. And there's the medic interpreting the rhythm and giving commands to the team to start chest compressions, to start an IV, give epinephrine. So get a lot of this. This is higher order thinking, right? This is a global agency, and this is just a means to practice and repeat over and over again the skills that you would normally learn in an advanced cardiac life support course. And ideally, that translates to better performance in a face-to-face situation. So, oh, that's it. Great. I thought I had maybe one more slide, but that's it. And I've got, I'll send Emily a copy of my slides with the references on there, but I'll take questions at this point. And I think I will stop sharing my screen if I'm able to do that.
Yeah, you should be able to just hit the screen button on the bottom.
No, that's not it.
Let me see if I can do it. While we figure this out, I'm going to ask a question.
Sure.
How does VR potentially help with empathy?
Yeah, so there are a number of VR applications. I'll give you an example. One of them was developed by Stanford University, their virtual human interaction lab. It's called Becoming Homeless. And the way it works is that in virtual reality, you become the person who is homeless, or you become the person of color who is a victim of racism, or you become the woman in an office meeting who is surrounded by men who are misogynist, who are dismissive and interruptive. So in Becoming Homeless, there's a scenario where you start out, you're in your apartment and you've been laid off from your job about a month and a half ago and you haven't been able to find other work. And you're sitting at your desk and you've got an eviction notice in front of you. And the narrator says, in order to make the rent, you need to sell some things from your apartment. So you start pointing and clicking at your laptop and your flat screen TV and other things. And in the end, you still don't have enough money to make the rent and you find yourself evicted. Thanks. And then you find yourself in your car and you've got all your belongings in your car and you can look around and you can see in your car the mess that's there, and you've got parking tickets on the dashboard that you haven't been able to pay. And finally, the police pull up behind you and you can see the flashing lights in your rear view mirror, and the police pull up and they impound your car. But the police officer tells you about a program where homeless people can ride the public transit at night. And this is based actually on a city where they actually have that program. And so you find yourself on this bus and it's nighttime and there's only 3 or 4 other people on the bus. And there's one guy in particular who looks a little creepy, and the narrator tells you this guy likes to harass homeless people and he will steal your backpack if you're not careful. But the narrator tells you if he approaches you and you just stare at him, he'll go away. So he walks towards you and you look up at him and you just stare, and eventually he walks away. And then you can point and click at other people on the bus and learn about their story. And so the idea of embodied cognition is that you feel like you're that person. And again, this was a virtual reality experience that left me sort of deeply immersed in my thoughts, sort of processing what I just experienced. And it was only a 9-minute experience, but really quite profound. I mean, much more powerful than anything you might experience if you were watching a video or documentary about being homeless. And I found that powerful. So, you know, from an HR perspective, that the whole empathy side of virtual reality will be very powerful for the soft skills, for developing empathy, for diminishing racism, for de-escalation training. I was just talking to someone about that today from Sunnybrook, and so that's a really exciting area in virtual reality.
Thank you. Does anybody else have a question? Otherwise, I will continue to go.
I have a quick question, if that's okay.
Yeah.
So I know that a lot of paramedic services right now are feeling really stretched. The dollar's stretched. Being able to bring paramedics in for CME, I know in Toronto it was twice a year, was onerous. So, I mean, our CME went for what felt like forever. We'd have a month break and then keep going. I'm wondering, with VR, could something be set up in several locations, maybe ambulance stations or targeted ambulance stations, and certain learning modules are in there, similar to like a Moodle where you go in, you do a quiz, you answer it, you're gone. Is there something similar with VR technology?
Yes, absolutely. So that could easily be done. I mean, the Health Scholars ACLS one is a good example. That could be, you know, you could even use a standalone headset where a supervisor brings it to a station. You just need a Wi-Fi connection, and you take a paramedic out of service for a couple of hours, and they do some ACLS scenarios, and that data gets transmitted to a website that you know, your training people have access to and can look at the analytics and see how that particular paramedic performed. So yeah, it's doable, and you know, the VR technology is just going to get better and it's going to get cheaper. And you know, I think about when I was a base hospital program manager, we did, you know, daily CME with a number of medics. But one of the other things we did was we did CME with individuals who were coming back from an injury or from a parental leave. And that required one person dedicated to one person for training. And you know, back then it struck me that was very human resources intensive. So we started, we actually started developing narrated lectures on PowerPoint and gave them a CD. We were flipping the classroom before flipping the classroom was a thing. And I think you could do the same thing with VR. You could have, you know, if it's one person coming back, you could have them do some virtual reality scenarios, so that the time that you do get together one-on-one for scenarios is more efficiently spent.
Okay, that's. I think most paramedic services are looking for ways now, and maybe I'm wrong, but looking for ways that they can deal with this training in different manners rather than what we've been doing for years and years. And I think there is an avenue here with VR that would help.
Yeah, the big question is cost. You know, is it the cost-benefit ratio? And I'm not sure I know the answer to that. It would really depend on what learning objectives you're trying to achieve and whether that can be done more cost-effectively. There was a study, I don't know if you noticed in my presentation, that described ACLS and virtual reality as being more cost-effective, but the comparator was high-fidelity simulation. So it's more cost-effective than high-fidelity simulation, but most of us use medium-fidelity simulation for ACLS, which is a lot less expensive. So yeah, it just depends on the skill or the scenario or the learning objectives you're trying to achieve. But I would say just my hope with educators in the college community, university community, and I would say the same to all of you here who are involved in education one way or another, is explore it, experiment with it. Take one program, take a small group, see what you think of it, and see if you think it's worth the investment.
Thanks, Rob. Troy's got a question.
Hey, Rob.
Hey, Troy.
Just wondering if there's been any research with respects to age cohort with how well they respond to this, because looking at our own environment, the younger folks really adapt quickly to all these changes. Some of our older staff are challenged a little bit with this. Is there any evidence on that?
Not that I'm aware of, but I've been doing an ongoing lit search, and I'm happy to share a link to that. It's on a Google Doc, so you can see the research that I collected. So interesting thing, there's quite a bit of research that's relevant to immersive virtual reality prior to 2016, but it was only 2016 where we saw high quality immersive virtual reality headsets. So a lot of the really relevant research is from 2016 on. So you might imagine there's not a great deal. I haven't seen one yet about age. And sorry, I'm laughing because I took on this role at age 60, and when I bought my first virtual reality headset and computer, the guy at the computer store looked at me, and the first thing he asked was, "Oh, is this for your son?" And I thought, wow, that's both ageist and sexist. So yeah, the short answer is I haven't seen any yet.
So we got 5 minutes. Another, issue that paramedic services are facing is PTSI. So I'm wondering, is there a role for virtual reality, not only in an evaluation context, before you hire, but also as a training opportunity, for example, exposure, or something, to that nature?
Yeah, boy, that's a loaded question. So the short answer is yes. So virtual reality for therapy is a whole of a different category of virtual reality, and it's being used in research extensively for pain management, for addressing phobias, for therapy for PTSI. And it's a big thing in PTSI, especially with soldiers. And what they do is they put soldiers back in a situation similar to the thing that initiated the PTSI in the first place, and slowly acclimatize them to that. So the answer is yes. And there's a Canadian company called Luxonic that's doing some work with the Alberta College of Paramedics to do exactly that sort of treatment to reintegrate paramedics into the field of PTSI. And I can give you that contact information if you like. But on the whole, stress inoculation, that's another great potential area for virtual reality. And there are biometrics built into the newer virtual reality headsets now that check pupillary size and gaze, and you add to that some galvanic skin sensors and ECGs and so on and so forth. They also have headsets that check pulses and blood pressures, and you can do sort of stress measurement and develop stress inoculation. And this is going to be important for us, for example, when we're taking students into multiple casualty incidents. Like I go to an MCI virtual reality and I think, oh, this is kind of fun, this is kind of cool, but I have no idea how it's going to affect my first semester students. And I hesitate to put my first semester students in it. We put our fourth semester students in it, but first semester students, might give them PTSI from seeing people dead and seeing people, exsanguinate while they, hesitate to put on a tourniquet. So yeah, the short answer is it's a really exciting area for both therapy and for stress inoculation.
Thanks, Rob. And Mike thinks he's got it figured out, and you've got 2 more minutes.
Rob, Mike, can you hear me?
Yeah, good to see you.
Perfect. Thanks again, a wonderful presentation. Just a tip and a question.
Yeah.
I'm just working with the emergency networks here in New Brunswick regarding the turnaround of departments. In other words, when a doc meets with a doc and they're turning over emergency departments, how they can do that in an effective way. And it is for them and for every nursing student or nursing department or floor when they flip shifts, it's a high risk experience, and they're still working with a number of techniques to get it right. I'm just thinking from a marketing point of view, if you're watching Accreditation Canada or talking to some connections in the Canadian Medical Protective Association, you may find some very motivated and good sales opportunity there. But the question I've got is, if all of a sudden I wanted to, or someone wanted to do some training, something such as how would you prepare nurses to deal with situations where there's not enough ventilators in the emergency, and thank God I don't think that's an eventuality most of us will be facing, but how fast from idea to production and available to use is this kind of technology? What's their timelines?
Yeah, well, as you might imagine, it depends on how elaborate a scenario you're trying to create in virtual reality, but on average, a 20 to 30-minute scenario will cost minimum 75,000 to 250 grand, and usually take between 2 and 3 months to develop. So it really depends on the product. It's hard to pin a number on it, but I've spoken to a lot of developers and a lot of different companies about this. In my role, we've been searching for primarily off-the-shelf products that are applicable to the different programs across campuses. But we're also looking at collaborating with companies to develop some stuff, particularly in the trades area. But yeah, that's a rough estimate.
Thank you.
Thanks, really good question. So with your permission, Rob, I'm going to wrap this up by thanking you so much for a lovely, very informative presentation.
Thanks for having me.
Yeah, absolutely. Thank you to everybody who came, and for anybody in the colleges, because there are so many of you here, just thought I'd mention that we do offer the iMedic, so the electronic patient care record, to colleges at, I believe it's no cost, because we want to help facilitate your education. So if anybody is running a program looking for a patient care record in the context of EMS, we can help you out there with our iMedic application. And then hopefully one day in our Certain platform, which is our education and credential management application, potentially relevant for the colleges as well, because we can track things like competencies, etc. Maybe one day we will be hosting virtual reality content and tracking in there as well. So if you want any more information about any of the stuff that InterDev is doing, please reach out to me. And have a heads up for the re-up of our webinar series following the summer. We should have some really good content cooked up for you for then. So thank you all so much again, Rob, Theriault, thank you so much. We really appreciate you, and everybody enjoy the rest of your day, and happy Canada.